What is the best treatment for upper eye bags? I'm 33 years old, and the bags upper my eyes make me look tired, and I just hate it. Creams and other stuff didn't work. What is the best way to get rid of these bags?
Thank you for your question. You're 33 years old and you've submitted two very good photos and you're asking how to get rid of the eye bags, and you mentioned that the creams just don't work. Well, you are asking a question that we deal with every day. I'm a cosmetic oculofacial plastic surgeon, and eye bags is one of the most common procedures we perform in our practice. So let's understand why those creams do not work, and then discuss the options that we would typically do for someone with your profile in our practice. First of all, let's define the issue. These bags are the result of something called prolapsed orbital fat. This means that fat that's normally around the eyes pushes forward and creates a bulge. This bulge it literally looks like bags under the eyes. Very often people think it's due to lack of sleep, due to allergies and sinuses, and although those factors can make the bags appear worse, the reality is that most of the patients who have bags under the eyes have some kind of genetic pattern that results in the puffiness appearing as young as the early teen years. So when you have this herniated fat, and certain MRI studies have been shown that it's actually not just fat that's pushed forward, but it's fat that's actually expanded or increased in volume, and has nothing to do with body fat. It is a very unique focused area. We've done this surgery for marathon runners and for people who are extremely fit with very low percentage body fat, but yet they have the biggest puffy bags under their eyes. So with that being said, when you do your research about under eye bags and plastic surgery, cosmetic surgery, you'll learn that it is standard to approach the bags under the eyes via either an external approach called a transcutaneous blepharoplasty or an internal approach called a transconjunctival blepharoplasty. In my practice for a young male patient like yourself, I try to avoid external incisions, and so I would do the transconjunctival approach. Now this is in many ways a more advanced approach because it is working close to the eyeball itself. And at the same time, a big advantage of this from my experience and opinion is that it preserves the structure of the under eye muscles that are responsible for eye shape. Unfortunately, a lot of people have external approach eyelid surgery, and unfortunately that at the same time the support structure becomes compromised, and they end up with their lower eyelids pulled down, something called lower eyelid retraction, or even their lower eyelid everted out, or combinations called ectropion. So the lower eyelid is a very complex and deceptively complex structure. It requires the balance of several factors, including what's called the lateral canthal tendon, which supports the lower eyelid to the bone, in connection to the bone, as well as the orbicularis oculi muscle, which acts like a hammock, and there has to be a balance between the amount of skin available and getting the results that you desire. So typically for someone like yourself, we would do a transconjunctival blepharoplasty. It leaves no external scars, and at the same time you are able to address the lower eyelid fat prolapse. Now we do a combination of resection, sculpting, repositioning, which is customized to the individual patient. So in addition to that, if there were any issues related to skin quality, then we would also employ a method of regeneration and improvement of skin quality using something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it takes advantage of the growth factors and the cells necessary for healing called platelets. It stimulates collagen, it stimulates blood supply, and it results in an improvement in skin quality. In certain candidates, we also employ some type of thermal-based treatment, whether it's fractional CO2 laser or a radiofrequency device to stimulate at a limited way just enough to get some more skin tightening. But that requires physical examination. This is not something that we can recommend from just a photo alone. So my advice to you is now meet with qualified, experienced cosmetic surgeons, particularly those who have extensive experience with lower eyelid surgery. I think like many areas of cosmetic surgery, the specialization and experience makes a big difference in the outcomes that people have, and that applies to all surgical fields. And get a sense of the aesthetic style and what the surgeons are suggesting. Very often people have written to us saying that I've gone to 5 doctors and I've gotten 5 different opinions, and so it's not unusual if that happens. But once you're comfortable with the physician, surgeon that you feel confident with, I think you'll find that it'll be one of a very nice thing to do for yourself. It is remarkable to me that how much of an impact the bags have on facial appearance, and once the bags are reduced and addressed, it really brightens up the whole facial expression. A lot of unspoken communication occurs when people have bags under their eyes. Everyone assumes that they're tired, they're not sleeping enough, they're using drugs. I mean, there are all kinds of unspoken messages that are associated with bags under the eyes that have been reported to me in over 20 years of practice. So I hope that information was helpful to you, and I wish you the best of luck. Thank you for your question.